Well, hello and welcome back to Wellbeing Wednesdays, brought to you by the Tulane University Counseling Center. I am one of your co-hosts, Shawna Foose. I am a staff therapist at the center, and I'm joined as always by my lovely co-host.
Hi, I'm Dr. Jinaki Flint. I am staff psychologist here at the Counseling Center, and today we are joined by Dr. Julius Austin, who is also a clinical therapist here at the Counseling Center. And Dr. Dr. Austin, is also the coordinator for OSAR, which is the Office of Substance Abuse and Recovery. So thank you for joining us, Dr. Austin.
It's a pleasure. I'm happy to be here. I'm excited to talk with y'all.
Great to have you.
Yes. So yours is one that I am so excited about because I want to hear about the work that you're doing on campus. You're doing some really powerful work. And so we are excited to have you here today.
Yeah, I'm excited as well.
Let's get started. And can you tell us a little bit about OSAR?
Sure. So OSAR, it's the Office of Substance Abuse and Recovery. It's gone through several iterations over 5 to 6 year span. So really it started with in campus health with Dr. Scott Timms, Dr. Alicia Chakowski, Dr. Donna Bender, Letitia Hilton, and a couple people from the Well. It was kind of like as well as a couple other people, who in the history of Tulane has put like a lot of blood, sweat, and tears into the genesis of this office. It really started from the idea of, we just need to help students. And that kind of morphed into, how are we going to do it? Well, we can put several things in place, like basics, which is it's an educational tool, kind of like an assessment for students. So, we started there, and then it's like, and then the thinking was we probably need a little bit more, from, to support students. And then we had the climate survey that came out a couple of years ago, which highlighted several key areas. And, substance use and misuse happened to be one of those areas, as well as like a lot of, sexual assault and violence. With the climate survey out, with, the student, substance usage rates being like at an all-time high, there was an ideal to create this office, or at least create the ideal, of this office. And then that's where I came in. So I was hired about 2.5 years ago. And when I came in, this office didn't have a name. It didn't really have, it had a general direction, but there wasn't any like real roots, So a lot of my job was figuring out some of those roots and how to stay, how to keep that balance between, or that connective tissue between campus health, the counseling center, victim services, conduct, dean students, and anywhere else I could lay my hands on, So OSAR is essentially an office of one that's comprised of many people, which is weird to say, but that's kind of how it is.
Yeah.
I'm a clinical therapist by trade. So for the most part, OSAR, the purpose of the office is to build relationships with students who use or misuse substances. And that's really the driving force behind, this office. So we do, traditional therapy. We also do assessments. But for the most part, we help students get connected to resources that will benefit them. So whether that's individual therapy with me, or maybe, consistent short-term meetings with me when a long-term relationship with the clinician on campus or off campus. That's kind of the work that I'm doing. Does that make sense? Like, okay.
It sounds like it's a lot of partnering too, a lot of partnering with several offices around campus and with students.
Yeah, yeah, I would say that, which is weird because I'm a clinician, so there's always this like clinical undertone of like the relationships that we build. But yeah, it's a lot of partnering. So this office wouldn't exist if it weren't for the partnerships and the genuineness of all of the offices that it kind of orbits.
So tell
Yeah.
us a little bit more about basics.
Okay.
What is it used for?
Mhm.
What does it mean for students
Yeah.
on campus, and how
Sure.
can they access it?
Yeah. So basics. The acronym. Hope I get this right. It's a brief alcohol screening for college students, and it's the brainchild of the well. So it started in the well um, a couple years ago, and it's been ran by several different people, but most recently Letitia Hilton, and she's done a really good job of curating the staff that can not only have a balance between being kind of present in that kind of comforting and therapeutic way, but also provide really strong education for students. So essentially, the students can get connected via referral source. So typically, this is what I see. I see students who may have, um, you know, uh, not been paying attention to their consumption level, and they're safe and fine enough to make it back to their dorm. But once they make it to their dorm, they may be, sick, or they may be throwing up, or they may be noticed by an RA where, they just look like, all right, this student may need help. That student is usually, you know, the TUEMS is usually called to assess the student. The student may be assessed as having maybe too much alcohol in their system, let's say for instance, and the student is sent to the hospital. The university, obviously hears about that. They're usually contacted by several different sources, but for this example, let's say they're contacted by the dean of students. The dean of students usually meets with them and says, you know what, I think it may be beneficial for you to receive a little bit more education with regard to like, alcohol usage. So not necessarily, and this is something that I want to get across to students, not necessarily like, hey, I'm punishing you for this. It's more so you could probably benefit from learning a little bit more about not only like alcohol consumption, but a little bit more about your relationship with, with substance usage, and where you find yourself maybe using more or using less, or maybe feeling pressure from outside sources, things like that. So she places them within the basic system, which is just like an online system that most, referrals have access to. And once that person is placed within the system, they get an email prompting them to fill out a basics feedback assessment. And the basics feedback assessment, it gives you, I think it's like a 20-page readout of, your consumption rates, how you feel, what your experience has been like, how safe do you feel, what do you use, substances for. It's a massive readout that gives you a bunch of different information. So once that assessment is done, then the student is sent to a window that allows them to choose which date they want to meet me on. And within the calendar, I have several different dates, so a student can choose from any date that works for them. And then once they choose that date, then I get an update saying that the student has chosen this date. And it's a pretty simple process from there. I get their assessment. I kind of read over it. I shoot the student an email with the Zoom link. And then we meet, and we talk about the assessment, but we also talk about all kinds of other things.
And is it just a one-time meeting?
Yeah, so typically it's a one-time meeting, but for the most part, we have it kind of embedded within the system that we meet twice. And usually, if a student is And I guess that's the benefit of having me take over, basics, is that, substance usage is kind of all housed within, the Office of Substance Abuse and Recovery, which means that, let's say a student is, let's say that a student, does go through the basics process, and I do meet with that student the one time, and in that one basics meeting, we talk and we find out that, man, there's a little bit more to uncover here with regard to substances. There's maybe some cultural issues, or maybe some past trauma, surrounding substance usage, maybe some childhood substance usage from the parents that maybe the student wants to learn a little bit more about. And then that's when, instead of transitioning them into a second basics meeting, we just transition them directly into the Office of Substance Abuse and Recovery, where we can do a little bit more of an in-depth assessment and give them a little bit more of like a clinical eye, as opposed to a psychoeducational eye, which adds levels to what we're doing.
That's amazing. I like the layers of that, first that education and awareness, and then there's something that's in there to transition students who may need, a little bit more care. So
What that allows us to do is it allows us to like not let anyone, or at least try to not let anyone fall through the cracks, so whether whether this was just a one-time event and it was just a lesson that you kind of needed to learn, and you've never had any experience using alcohol or any other type of substances, and, you needed psychoeducation, and, you kind of figured out like, oh, maybe this is something that I don't want to try. There's a place for that student, but also if you're like, in the throes of substance, misuse, and it's been something that's been consistent over your college education, and, it took basics, for like your en route to get to, more clinical help, then there's a place for you as well.
what are some of given what we know about the increase of substance use on campus, what are some of your then overarching goals for meeting that need on campus? What are you hoping that OSAR will be able to do realistically?
All right. So see, when you throw in the word like realistically, that's when you start to narrow down some.
Right.
No,
because we can have the big picture dream, right? And then there's the dream that will, that we need to.
All right. So realistically, this is going to have to be more than a one man office, one person office. I think realistically, once the recovery community is kind of like off the ground and like bolstering, there's going to need to be a little bit more openness from my office, so that I can capture not only a wide array of students, but also so that there is a massive community of sorts that exists. So I guess like my overall goal would be that this office and the recovery community is kind of like one, but also separate in a sense. And we're housed under one office, So my office, OSAR is housed in, campus health, the campus health umbrella, but it's also a part of the counseling center, and because it's a part of the counseling center, there's specific, ethical guidelines that we kind of have to follow, and then because it's a substance, use focused office, there's even more, constraints on, who can see notes and who can see my calendar and like what I'm doing, which I think is beneficial. But my hope would be that when a student says, I'm having an issue with substance use, then like there's one place to go on campus where all of their needs can be met, you know. And there's more than like one person that they can go to within the house of substance misuse, you know, and recovery on campus. Because I feel like, you know, the Office of Substance Abuse and Recovery is, you know, it's fine, but there's also a recovery community. So what's the difference between the two? You know, and for a student who maybe there's some stigma around substance use and who may not have, uh, the comfort, you know, to just say, hey, I need help. It may get a little confusing for them to say, well, you know what, I'm just not even gonna approach anyone because it's too kind of complicated to figure out. You know, so I guess, you know, briefly, my long-term goal would be to have the office kind of like a beacon, you know, for substance misuse on campus, where we're not only doing clinical things, but we're also doing, you know, outreach. We're also doing community efforts within the community of New Orleans, you know, things like that.
And you are also the substance use and education advocate for the counseling center.
Exactly.
So you're already out there with that outreach component. So that has to be a good overlap.
Yeah, so and I want to maintain that stuff, you know. So like I want there to be like kind of like a separation, but also a tethering line too, you know. To you know, because if I can speak for myself, I feel like I need, and this office needs, those relationships with the counseling center, the Well, Campus Health, all these campus partners to survive, you know.
Yeah. We're going to do a community of care. That's what we need.
Right.
Yeah.
You mentioned the recovery community. Can you just say a little bit about what that is and where we are in the process of that community really becoming a reality?
Sure. Yeah. So the recovery community the recovery community is housed in the Well. So essentially, it's separate from OSAR, but we have a lot of ties. So it's also an office that's ran by one person, Jacob Goldberg, who is, I mean, I can't say enough about how humble and how genuine of a person Jacob is to be kind of running, you know, the whole community. Um, yeah, it's somebody that you can really trust in like guiding the community in the way that it needs to go. Um, so yeah, it's in the process of gathering not only members, so people within the Tulane community that are, you know, maybe struggling with, you know, substance usage, but it's also in the the beginning stages of creating a physical space for the community, you know, which is a house right off of campus. So you know, they're in the process of you know, getting more financial support and financial backing, or remodeling the house. Um, Figuring out what the house is going to look like and what it's going to be used for, and who has access to it, and the little tedious things that, you know, you kind of have to focus on. So kind of like my office, that, you know, the recovery community is doing, you know, multiple things at the same time, trying to build the community, as well as, you know, build the community from like a people, you know, perspective, but also from a very like, you know, where we're going to meet, you know, what you know, where we're going, how are we going to meet, you know, what does this community need, you know. So this iterative process of going out to the community and saying, what do y'all want to do, you know, and like coming back to, you know, Campus Health saying, this is what they said they want to do, can we do that, you know. So me and Jacob work really closely in not only the patients that I see within my office, but a lot of the sitting down in an office for an hour talking about what does this mean, and, you know, what is, you know, how can we merge the two communities, but also have some, you know, they also maintain their own identities and work around each other. Yeah, it's tough, but we're in the beginning stages of both things. So we have a real opportunity here to kind of create the place that we want to create.
And I love that both entities are really a direct response to the community need.
Yeah.
We know
Yep.
we have students in recovery
Yep.
here at Tulane who
Yep.
really need to find each other and have
Yep.
a sense of community.
Exactly.
Yeah. And y'all, like on a personal note, I don't ever want to forget that, like I don't ever want to forget that the genesis of this office was based on community need, which means that like there's some ownership from the community, and that ownership from the community needs to be honored. I don't ever want to do anything in this office where I'm like, well, that suits my needs, I would much rather be like, my needs are clinically, clinically, these are my needs, and clinically, this is what I need to feel comfortable doing my job. But what if the office doesn't need me to be so clinical? What if the office needs something different? Can I provide that? Or is there a way to manipulate the office to fit the needs of, the counseling center, the well, the campus health, as well as the people? That's what we're in the middle figuring out,
Right.
Well, that's building a community of care. And that's what I mean by powerful work. I think more than anywhere, your work pretty much touches on every aspect of this campus. There's every campus partner, every nook and cranny is impacted by it. So so designing it, you're at the forefront of really designing a program and solutions and
Yep.
care for students within this campus community. And that's got to be exciting. And of course it's work, but
Right,
if
right.
anybody's up for the challenge, I put my buck on you and Jacob.
Well, to be honest, we're definitely up for the work, but I can't stress enough how important it is to have, so one, on the ground level, like, supportive, colleagues like y'all, who would just ask, how you doing? How you doing? Like, how are things going? And maybe not have the clearest idea of like what I'm doing in my office, but have the genuineness to say like, I'm here, if you need something. That plays ripples into, this community that we're trying to build. But also like, the structure of having, the staff of the well and, Scott Timms and, the leadership within the counseling center that, that really, oh man, provides the scaffolding to free fall, into like, how do you set up this basics portal? Because we're moving into a new system. So I'm free falling here, and knowing that I can send, Letitia an email saying, hey, I need some help. And I got you on 2:30 on Wednesday, can we meet? And just have that time where she's carving out that time to say, what do you need? How can I help? Like that stuff is so important for building this type of community.
True. I really appreciate our partnerships with the well. They are really very, very helpful, and they're strong partners.
Yep. Strong.
Something occurred to me just now as you're talking. You mentioned earlier about people being referred in for a basics meeting with you. Can a person come to find you voluntarily without having been referred?
Yeah, so we built that function into basics as well as into OSAR. So I would say that like most of the students that I see in OSAR are referred to me by the counseling center.
Mm-hmm.
So, and it's it's not like a hard referral. It's more or less like hey, I think this may be something you may be interested in, and it may inform the work that we do clinically, So I've been able to have the student come in and say like, I'm voluntarily coming in. You don't have to report the findings of the assessment that we're doing to anyone. It's just really to help me grow and to help me understand a little bit more about my relationship with substances. And then to kind of create that team of care where I'm communicating with, the student, and the student's communicating with me, and I'm communicating with their primary clinician. Their primary clinician is communicating with me, and we're all kind of working together to see how the substance use play a role in some of the clinical work that, they're doing within their relationship. And that's all because a student just, called the counseling center and said, hey, I want to set up an appointment with Dr. Austin. And, our lovely, patient reps who, this place wouldn't exist without. So, they set them up with a consultation session. And, the sessions are usually, it's a 3-part structure. So it's a consultation session, which is 30 minutes. And that's the session where I'm like, all right, so like, where are you coming from and what do you need? How do you think this will help? To an assessment session where we do the assessment and we kind of gather as much information as we possibly can. And then the results session where I kind of say, this is the information we've gathered, and from this information, here's some treatment recommendations, and it's a collaborative process. I want to keep that through line throughout the whole existence, right, of this office. It's a collaborative process. So listen, this was my treatment recommendation. Do you feel like this works for you or not? If it doesn't work for you, then let's kind of collaborate on something that could possibly be more healthy for you, or maybe better aligned with your schedule as a, second-year law student. So
Teamwork
yeah,
makes the dream work.
Yep. Yep.
So thank you so much. I can see now we're going to have you back.
I would love to come back anytime.
Yeah, because it sounds like a lot more excitement is coming for us through this office and through the collaborative partnerships with campus partners, but more importantly, the recovery community. So thank you so much for seeing us today, Dr. Austin.
Oh yeah, I mean it's.
Before we wrap up, I just want to share with our viewers the details for how to reach all of us at the Counseling Center. Just reminding everyone that our physical location on the Uptown campus is in the Diebel Complex. That's the parking garage by the Riley Center on the first floor. And the hours that were available have been extended. They were extended last year, but Monday, Tuesday, and Thursday, we stay till 7, and on Wednesdays as well. And then on Fridays, we close at 5. And as Dr. Austin mentioned, we would not be able to do the work we do without the work of these 2 amazing women on your screen. Ms. Charlesetta and Ms. Belinda. They are our patient representatives. They're at the front desk. They answer the phones, and they're really your first contact if you're going to come to see anybody at the Counseling Center. And our model is really available. We try to be as available as we can when students call. So when you make that phone call to the Counseling Center, Belinda or Charlesetta are going to try to schedule you for your first appointment that very same day. We have, every one of us has time set aside every day to take those appointments. So you'll call 504-314-2277, and you'll be scheduled with one of our staff. They'll meet with you for a consultation, kind of how Dr. Austin explained, and it can be about anything. And then in that consultation appointment, the person you're meeting with will make some recommendations, and then there'll be a plan. And so by the end of that, you'll really kind of know what the next steps are going to look like for you. And maybe that does include consulting with Dr. Austin in OSAR. Maybe it includes other consultations with other partners. And that's what we're here to do in that first appointment. Most of our appointments right now are being conducted over Zoom because it gives us the ability to not have to wear masks and very clearly see each other, which is really important to a trusting relationship. So that's the way to find us. Reminder too that we have several groups that are getting ready to launch right now. And in that initial
already launched.
Yeah, some have already started, but there's still some pending. So if you see this list and think, oh my gosh, I really want to come to Mindfulness for Wellness, you can make one of those consultation appointments to talk about that, and we can get you in on some of these really, really great groups. And that is all I have to share in that realm. Like Dr. Flint said, Dr. Austin, this is so important, and I'm so glad we had you on, and I do think we need to have you back because this community that you're growing single-handedly.
Yes, absolutely.
We all want to be a part of this and help
Yes.
to really foster that growth. So
yeah, if there's anything you ever need from us, you know where to find us.
Yeah, I mean, y'all. I mean, I don't know if y'all want to keep this in or not, but things like this, the things that y'all are doing, really puts like a human touch to some of the things that a lot of us are doing on campus. You know, so
we want the community to know us and know that we're people and that we're really available for all students wherever they are in the journey of their lives. Yeah.
Whatever they're grappling with, you know, there's always someone. You know, this is when you come on this campus. To me, I feel like you walk into a family.
Yep.
And all that families offer you, all the support that families can offer. So if you are a student here, this is the Tulane family. Now you're a part of it. And so you have all the benefits of now being a part of that family.
Sure. All right. Well, thanks again, Julius. Thank you, Jinaki. As always, it's such a pleasure.
Thank you, Shawna. Thank you, Dr. Austin.
And we'll see everybody every Wednesday. Check us out on TU Campus Health on Instagram or on our YouTube channel. We'll be back next week with another episode of Wellbeing Wednesdays. Thanks, y'all.